Well, greetings. I think we have a quorum according to Mr. Fairchild. So, and his counting, I believe we have a couple people, at least we will have a couple people online. I see Bernice on there. Hi, Bernice. Welcome to the Commission on Improving the Status of Children in Indiana. First order of business is to, and I think the only order of business and our only action item is to consent to the minutes from last meeting, which should have been sent around. Do I have a motion? Do I have a second?
Second.
All in favor?
Aye.
All- Excellent. I got you, Bernice, you and I. We have adopted the minutes and we're going to move right into it. We've got a pretty action-packed agenda for us. So we're going to try to move as efficiently as we can. And we've already picked up a little time. So we're going to do YURBS, as I call it, the Youth Risk Behavior Survey data. I always call it YURBS. Maybe people don't want to call it YURBS. But Youth Risk Behavior Survey data, we've been anxiously waiting. I think we talked about last time. So we have a presentation from the Department of Health. I'm not sure who's presenting because I don't have a name on who's presenting, but welcome. And you can introduce yourselves when you get here. YRBS. You've heard me say that before, so apologies. YRBS.
Yeah. Good morning, everybody. I will let my teammates here introduce themselves. I'm just going to be the color commentary for today, just to add a little bit of context to some of the data. And just so you guys know, there is a lot more behind what we're going to present. So we only, we have a short amount of time, so we'll go through this data, but if you want more, that is available to you. Go ahead.
Good morning, everyone. Thank you so much for having us here today to chat through the 2023 Youth Risk Behavior Survey data. This is only the third time that we'll have presented it, so we're excited that it's here. Kate, Dr. Weaver, and I will begin with a brief overview of the survey and then dive into the data. Okay. So again, we are discussing the 2023 Youth Risk Behavior Survey. The Indiana Department of Health administers this on behalf of the CDC. So our mission is to promote, protect, and improve the health and safety of all Hoosiers. And our vision is that every Hoosier reaches optimal health regardless of where they live, learn, work, or play. Moving straight into the background of the survey, as I said, the survey was designed by the Centers of Disease Control and Prevention. And it has some important goals in helping us identify emerging trends in adolescent health. It also helps us understand youth risk behaviors from the perspectives of the young people that are engaging in these behaviors, as well as their experiences. And then additionally, the survey allows us to see our state comparisons to national data, and you can also make comparisons to regional data as well. For our data usage, we have a lot of partners who rely on this information to inform their work and data-driven decisions. On this slide, you can just see a couple examples of where our data is currently being utilized. And then as far as where we're sharing it, the 2023 YRBS data will hopefully come up on the IDOH website soon. Additionally, we are in the process of creating a YRBS data dashboard to make our data easier for our partners to navigate and utilize in their work. But currently, a data dashboard is available on the National YRBS and Profiles Explorer sites. I do want to note that there is a 2-year delay between when the data is posted on Explorer and when Indiana receives it. So by creating our dashboard, we give our users about a year advance usage for this information. For the background of the survey, it's been conducted since 1990, so it's been around for a long time. It's conducted every other year during odd-numbered years, so 2021, 2023, 2025, et cetera. And we do it during the fall semester, so between January and April. Our sample consists of a represented number of high school groups. So we submit 300 schools to CDC and 50 schools are randomly selected for participation. We conduct our YRBS alongside the Youth Tobacco Survey in a double draw. YTS selects 60 schools. The reason we double draw is so that our schools aren't doubly asked to take 2 surveys from the health department in the same year. This makes sure that we have different schools participating in different surveys. In total, we asked 99 questions, and we conclude our question response period in just 1 class period in 45 minutes. Only 1 to 4 classrooms at each school participate in the survey. And that all comes from CDC's methodology to ensure the data is weighted. The YRBS monitors a whole bunch of behaviors that are listed on the slide right here, but we'll talk through and navigate them individually throughout this presentation. And then additionally, 50 schools that participate receive $500 for their participation. We're also going to share the school health profiles data with you all today. This comes from 2022, and the reason that we tell these stories together is that the 2 pieces of data work together really, really beautifully. So our school health profiles data is the environments that schools are attending or the environments that students are in every single day. These perspectives come from principals and lead health education teachers, whereas our YRBS survey is student perspective. So we can see how student perspectives are impacted by the environments that they're engaging in every single day when we look at these data points back to back. For profiles, in order to get a representative example, we do all public high schools and middle schools, and about 500 or 300 total schools are selected for participation. So you all have seen this slide in the past because Kate presented it to you in December. But just as a reminder, Indiana's had a little bit of a tumultuous history with getting to weighted data with YRBS. Achieving weighted data is entirely dependent on schools and students and school districts opting into participation. Participation is not mandatory. So you can see here that we have data from 2015, we have data from 2021 and 2023. Something really exciting having that 2021 and 2023 back to back is that this is the first time in over a decade that we're getting to look at trends together from consecutive cycles. This slide that you've also seen as well highlights what makes it difficult to achieve weighted data. So every red X that you see on the slide is an opportunity where the survey may not be taken by either a school district, a school itself, or a classroom or a student. With that, we're looking at the 2023 sample characteristics. So on this slide, you can see a breakdown of who participated in the Youth Risk Behavior Survey this year. You can also see our participation rates for school response rates, student response rates, and then our overall participation rate. As I said previously, we did achieve weighted data this year, which means that we have the opportunity to share the data with you all, which is super exciting. So the first category that we're going to look at together is general health and healthcare. So on this slide, we begin by asking students how they would describe their overall health. You can see on here that 40.5% of students said their overall health was good. Unfortunately, this is a decrease from what we saw in 2021. When we asked students specifically about their physical health, 52.5% of students said that they have good physical health. And then we asked the same question, but specifically about mental health, we see 33.7% of students saying that they have good mental, or they have not good mental health. Sorry. The first statistic is a positive and the second are displayed in the negative. All 3 of these statistics did move in the wrong direction. So we're seeing worse overall health as reported by our students. When we're asking students about their healthcare as well as their sleep, we can see that 73.6% of students saw a dentist for a checkup during the last year. When we asked students about seeing a doctor, 58.3 or 68.3% have seen a doctor. When we asked students about their sleep, 22.4% of students got 8 or more hours of sleep on the average school night. And then finally, when we asked students about their screen usage, we can see that 76.3% of students report being on a screen for more than 3 hours a day for activities outside of their schoolwork. In previous commission meetings, we've talked about how mental health and sleep are tied together. And here you can see that our students are less likely to get more sleep as they get older, especially among our males. But another thing to note is that our sleep has gone up from the previous year. So our students are getting more sleep than they did in 2021. But still that 32.1% is a pretty low rate. When we are asking schools how they are educating their students on health, we can see that 52.5% of schools have required health education courses for their students. And then linking back to that provider questions we talked about earlier, we can see that 86.4% of students have a full-time registered nurse on staff who's able to provide healthcare services to their students. Moving into our next category, we are looking at weight. On this slide, you can see the percentage of students who were overweight was 15.1, and the percent of students who were obese was 17.4. When we asked students how they feel about their weight, 33.4% described themselves as slightly or very overweight. This is one area where we see like a beautiful symmetry in our data, in that the number of students who report feeling overweight is really, really similar to the actual number of students who are overweight or obese per CDC calculations. When we ask students about trying to lose weight, we can see that 48% of students reported trying to lose weight in the past year. As we look at this slide on obesity, we can see that in the recent year, obesity overall went down slightly. However, it did increase among our male students. Looking at this from a prevention standpoint, we know that adult obesity in Indiana continues to rise. And so it's important that we continue to work at and monitor childhood obesity as well. This has been a priority of the state and local health departments. Moving into nutrition. When we ask students about fast food consumption, we can see that 24.5% of students had at least one meal or snack from a fast food restaurant in the last year. When we look at drinking soda, we can see that 25.4% of students did not drink soda in the past or on a regular basis. And then we ask students who do drink soda, we have 18.3% who report that they drink one or more per day, and then 11.2% of students who are drinking soda or pop twice or more per day. Moving into physical activity. When we ask students about their physical activity, we can see that 39.6% of students participated in physical education courses. When we look at students who participated in physical education courses at least 5 days a week, we have 22.4% of students participating in PE 5 days a week. When we break this down further and we look at the number of students who participated in at least 60 minutes of physical activity, whether it was at school or on their own, we have 44.5% participating in physical activity 5 or more days out of an average week. When we ask students about engaging in physical activity every single day, we can see that 23.3% of students participate in some form of physical activity every day. And then when we ask students do they participate in physical activity at least one day, we have 12.7% of students who are engaging in physical activity at least once a day. In our next trend, we can see that physical activity is highest during freshman year, which ties really, really well to this next slide about required physical activity in schools. We can see that schools are often requiring PE for our 9th graders, but this drops pretty significantly when we're looking at it among 10th, 11th, and 12th grade. When we ask students about participation in classrooms, during the school day outside of their PE, we have 46.5% of students who are engaging in physical activity at school, but not in a PE capacity. And then we ask schools about offering physical activity equipment for student use before school. We can see that 47.7% of students have access to that equipment before school. Moving into injury and violence. When we're looking at automotive and driving behaviors, this got real small for me. Thank you. When we're looking at automotive and driving behaviors, when we ask students about seatbelt usage, we can see that 43.8% of our students report wearing a seatbelt in the car. When we ask students about using the internet while driving, 53.7% are using the internet while driving for something other than their maps. This is the first time we've asked this question in YRBS, and it's definitely something interesting to look at. When we ask students about alcohol and driving, we can see that 12.8% of students have been in the car with a driver who is drinking alcohol, and that 5.7% report drinking alcohol themselves while driving. When we ask students again about wearing their seatbelt, we can see that among some populations that this has slightly increased in the recent year. This highlights the importance of continuous education. Our youth advisory board gave an incredible presentation at the roundtable on mental health last week. And one of the things that our youth said was that the young people of today are dealing with really similar issues to the adults of today, but just social media is kind of added in as an additional component. So we see things like wearing a seatbelt being something we need to continue prioritizing. And something as similar is seen when we look at students who have been driving and drinking alcohol or ridden with a driver who is drinking alcohol. On this next slide, we are looking at school safety. When we ask students about whether they've been bullied on school property, 21.9% of students report being bullied on school property. When we ask students specifically about electronic bullying, 20.7% of students have been electronically bullied. When we ask students, have they ever not attended school because they felt unsafe at school or unsafe on their way to school, 12.8% of students said that they've missed school due to feeling unsafe. This is a rather significant increase from the previous year. And then when we move into students being threatened with a weapon on school property, 10% report being threatened and 4.2% report carrying the weapon on property themselves. Finally, when we ask students about physical fighting, 17.8% of students report being in a physical fight in the last year. So we talked about electronic bullying, bullying and social media also recently in a commission meeting. And it's just important to emphasize with this slide that we're continuing, or we are seeing a rise in electronic bullying in the recent years. And so it's definitely an important topic that we continue to look at. Additionally, on this slide, as I said earlier, you can see a significant increase in the percentage of students who aren't attending school because they feel unsafe. Kate, later in the presentation, will talk a little bit more about community safety. So I ask that you kind of keep this trend in mind as she offers additional insight. When we again ask students these questions, but we're looking at our LGBTQ students, you can notice that our LGBTQ students are at double or more risk for many of the characteristics that we just discussed. That includes bullying, electronic bullying, not going to school because they feel unsafe, and being threatened with a weapon. When we ask schools about their communication regarding bullying, we can see it's quite high. Many schools are providing information on electronic bullying, oral communication, and other related topics. And then when we ask schools if their teachers are receiving professional development on these topics, again, we can see pretty high rates with 96.6% of staff receiving a professional development on bullying. Moving into my last section for today, tobacco use. When we ask students about current cigarette use, 6.1% of students report currently smoking cigarettes at least one day a week. When we ask students about frequent cigarette usage, 1% report using it 20 or more days out of a 30-day month. And then we asked students about currently smoking cigarettes daily. Only 0.6% of our students smoke cigarettes every day. Yeah.
Taken up. Just turn the page and it goes back up with vaping.
Yeah, so it's an interesting trend and interesting that you asked because we can see after years of decrease, we have a slight increase in the recent years, which again echoes back to something I said earlier about just continuing to educate and communicate on topics. Just because we notice a decrease over many years doesn't mean that information exchange continues to end, because trends can always move back up, move back down, and often in reaction to knowledge.
That's cigarettes, not vape.
Vaping's right here. We're doing that one next. No, but also important and probably the one that we get the most questions about in the tobacco area. And I will just mention really quickly, the Indiana Department of Health, that YTS survey that pulls 60 schools, they also have a robust group of questions on tobacco use in general. So we have a small snapshot, but if you're looking for something more comprehensive on those topics, it is also out there. And happy to connect you with our colleagues in that space. So when we ask students about current usage of e-cigarettes or a cigarette, 19.7% of students use either a cigarette or an e-cigarette. When we ask students specifically about e-cigarettes use, we can see that 17.9% of students are using an e-cigarette at least one day out of the week. When we look at more frequent use, we have 7.3% of students who report e-cigarette usage on 20 days out of a 30-day month. And then when we ask about daily use, we can see that 5% of students are using e-cigarettes daily. So our e-cigarette trend is a little interesting, mostly in that you can see there's a pretty big gap in the way that our trends are moving. They're a little bit more unpredictable than some of our other slides. But it's important to see that these gaps are increasing and that we continue to address where they're occurring. And then not last slide. Last YRVS slide I have for you is that we can see that e-cigarette usage increases rather significantly once students reach their senior year of high school. When we are asking schools about tobacco prevention policies, you can see that about 59.5% of schools have tobacco prevention policies in place. And then when we ask schools about education around tobacco use, we have 92.3% of students who are providing student education on this topic. So there's a lot of education going on, but less school policy. And that is my last one.
Great. Thank you, Sam. Good morning, everyone. I'm Kate Shadle. I also work at the Department of Health in the Maternal and Child Health Division. I'm going to talk a little bit about alcohol and substance use here. You can see that about a quarter of our students are drinking at least one day within the last month. This is up from 2021 when we had about 20.6. So we are a little over the national average here. And within that, you see about 12% of our students binge drinking. That's defined as 4 or more drinks in a short period of time, or 5 or more drinks in a short period of time for males. You can see a trend here similar to tobacco use and vaping. This is higher in our seniors, but you can see also that female youth are using alcohol consistently earlier than our male youth. Again, if you ask of those who are binge drinking, you're more likely to see that behavior among our seniors. And next transition into marijuana use. 29% of our youth have ever used marijuana, with about 15% of those currently using marijuana. That's within the last 30 days. We also tend to ask of those who had some early initiation into marijuana use. We define this as use before age 13. This is at 6.3%. This is up from 4.4% in 2021. So I just think that is something we'll continue to monitor as our neighboring states legalize marijuana. When we look at other substance use here, this top statistic It always alarms me. About 26.5% of our students have ever been offered a substance to buy on school campus. Do you have a question?
No, I don't have a question. I just have a small
Yeah,
comment.
go for it.
Around the country, they are dropping the term marijuana and using the term cannabis. So I kind of want us to think about that. If you look at all of the states either legalizing, they are not talking in terms of marijuana, they're talking in terms of cannabis.
Yeah,
So
right.
you gotta kind of change the
Yep, and
vocabulary. I mean, I just
Sure.
wanted to point that out.
sure, thank you. We will take that note back to the CDC because they
They
make
said
these
that-
questions. Yep, they make and validate the questions among our youth. So great feedback for them.
Okay.
Yeah,
So just so you know, as the public health, we do use cannabis, but these are how the kids were asked the questions. And so I think that's
Okay.
probably why
Why?
they use it
All right.
specifically marijuana.
Yeah,
Yeah,
thank
thank
you.
you. Yeah, but they, not all. of them
It makes,
would know
it makes a
what cannabis
difference.
would be.
It makes a
Mhm.
difference.
sure. Yeah, okay.
So it was called pot when I was.
All right, so I'm just going back to this slide, 26.5% of our students have been offered a illegal drug on their school property. When we look at a sort of lifetime use of other substances, you can see here 13.3% of our youth are using a prescription pain medicine that can include codeine, Vicodin, OxyContin, hydrocodone, or Percocet in a way that was either not their prescription or they were not following the rules and guidance of their prescription. So another 5.9% used inhalants, 3.5% were using ecstasy, 1.1% students were using cocaine, 1.8% methamphetamines, and 1% whoever used heroin. When we align this with our school health profile survey, we ask if teachers are teaching anything around alcohol and substance use prevention. Again, this remains very high, around 93.7, but you can see that decline just slightly over the last decade. I'm next going to move into sexual behavior. You can see here that 38.7% of our youth have ever had sexual intercourse, with 27.5% sexually active now. That's defined as within 3 months of the time they took the survey. And about 6.2% of our students had sexual intercourse with 4 or more partners during their lifetime. That is up from 5.2% in 2021. You can see sort of this trend here. As anticipated, students who are more likely to have sexual intercourse, it increases over their high school career, highest rates among our senior youth. This is a pretty consistent rate across all our races and ethnicities here, but likely higher among our LGBTQ youth population as well. When it comes to contraceptive use, you can see about 50% of our students are using condoms when trying to prevent pregnancy here. Another 36.2% of our youth are using some other form of birth control, IUD, patch, implant, etc. And about 6.4% of our students said we don't use any method to prevent pregnancy while engaging in sexual behavior. We also asked youth about revealing electronic messages. 29% of our youth have received a text or an email with a revealing or sexual photo of someone. And another 14.2% said they were the ones who had texted, emailed, or posted a revealing or sexual photo of themselves. When it comes to dating and sexual violence, I just want you to know that all of these rates have gone up since 2021. We have 14% of our youth here have experienced sexual violence that they did not want to do. And another 11.6% have experienced physical sexual violence, which is we define as forced intercourse. Those are just general questions about sexual violence. These last 3 questions are about dating violence. So this is 31% of our students said someone they were dating or in a relationship tried to emotionally control them or restrict them or hurt them in some sort of way. 10.6% of our students said they experienced that sexual dating violence, with another 12.1% who experienced that physical dating violence. This question we did not have on the survey for our 2022 school health profile survey that is defined by the CDC, but I wanted to throw this up here again. From 2020, 81.1% of our schools do not provide any sexual or reproductive health services there on site, despite having those registered nurses on most school properties now. I also wanted to share here just this trend of, do schools provide students with referrals for anything from HIV testing and treatment to pregnancy testing and prenatal care? Over the last decade, you've seen a decline, but over the last 6 years, it's remained pretty steady with about a quarter of our schools providing referrals to those services. And then lastly, we ask students if they talk to their parents or other adults when it comes to what to expect regarding sex. You can see here, this has gone up over the past couple of years, which is great. And you can also see here that females are more likely to get what I quote unquote, the talk from their parents or another adult here than males. All right, and mental health, just want to preface that we know at the last commission meeting, our colleagues at DMHA gave an amazing overview of where we are with suicide prevention in youth. This data is going to echo what you heard last commission meeting. I'll start with some of that school health profiles data. We ask if the lead health education teacher receives professional development on both emotional and mental health during the 2 years before the survey. This went down about 10% from 2020 to 2022. And we also ask if there's any sort of suicide prevention required in a course. And this is at 87%. I would love to see this get up to 100%. All right, and here's what you likely all know. Sam had mentioned earlier, 33.7% of our students said their mental health was not great, with 47% of those feeling sad or hopeless for greater than or equal to 2 weeks straight, so much that they stopped doing normal activity. That is the definition of depression in about 1 out of every 2 students in high school. Another 25% of our youth, 1 out of every 4, have seriously considered attempting suicide, with 23% of those making a plan to attempt suicide. And here is the worst part. We are at 15.7% of our youth who actually attempted suicide, which is up from 11.8% in 2021. I have, as Dr. Weaver mentioned, slides that break down every single one of these questions, but I just am sharing one with you today for all 5 of those questions. These trends look very similar. We see females almost at higher in every single category of risk here for suicide. We see similar rates across races and ethnicities, with a slightly higher risk for our multiracial youth. And for our LGBTQ youth, they are generally about 2.5 times higher the risk of suicide, planning, contemplation, and attempts. And I put this last slide in here about those who actually attempted suicide. We are trending the wrong way and going up. I'm going to tie this in with adverse childhood experiences. I know this is also something that has come up often at the Children's Commission here. We asked these questions for the first time in 2021 and repeated them in 2023. I'm not going to read the text that's on the left. I'm going to tell you what this corresponds to here. 36.3% of our students have experienced already a prevalence of household mental illness. That's someone in their house living with mental illness. Another 28.8% of our youth, are living with someone who uses alcohol or drug use and has a problem with that. Another 19.4% of our youth have experienced witnessing community level violence. As Sam alluded to earlier, this is up from 14.8% in 2021. And so we have more and more youth experiencing this community level violence and witnessing that. And then lastly, about 18.1% of our youth are, have a parent or someone in their life that is incarcerated, an incarcerated relative. As I flip to our next 4 questions, 12.7% of our youth have experienced emotional abuse. 8.3% of our students have experienced sexual abuse with someone 5 years or older than them. 3.4% have witnessed intimate partner violence among adults in their household, and another 2.4% have experienced physical abuse. We also ask about unfair treatment and perception of youth. We have 34.5% of our youth who said that they were treated unfairly based on their race or ethnicity. Those youth also said that 2.5% of them have seen their parents or relatives treated unfairly based on their race, ethnicity, their language ability, and more. And then lastly, 23.7% of our youth said that they were treated unfairly based on their sexual identity as a LGBTQ youth. And then lastly, when it comes to home life and neighborhood environment, we see that 81.2% of our youth feel safe and secure in their neighborhood. And this nicely aligns with the 19.4% of youth that have seen neighborhood violence. So you can see that sort of check here on our students telling the truth, and those very much align. And then lastly, a new statistic for us, 3.8% of students experience unstable housing. It is something we are looking at in my commission task force of children's health and safety. And lastly, when it comes to things like extracurricular activities and parent support, I'll go through these. You can see that 58.9% are involved in school activities for 1 or more hours a week. I'm going to skip to that third one. 29.6% are involved in community groups. Another 27.6% are involved in volunteering. But you see about 43.2% of students working a job at least 1 or more hours. But 27.6% of those are you doing that job so they can help cover costs associated with their family, rent, utilities, and more. We see about 60% of our students have plans to attend a 4-year college when they complete high school. And when it comes to phone usage, you can see again that 76.3% of our students are on their phone 3 hours or more outside of those additional things. And then this is the first time we asked this question. 75% of our students use social media several times a day. And I do not think that number shocks anyone. And then very last, I want to just talk a little bit about parent and social support here for our youth. You can see here 85% reported that they have a parent or adult in their life that makes sure their basic needs are met. You can see another 83% of students that say they have parents who know where they're going to be most of the time. And 71% of our students said there are consequences for their behavior in their household if they're not following guidance and advice from their parent. On the flip side of that, we see that 81% of our students would feel comfortable seeking help from adult or a trusted adult and parent in their life. But just 46.7% of them said, I'd actually talk about my feelings to an adult in my household. Unfortunately, just 50% of our youth feel like they are close to people at school, and another 51% said they could talk to a friend about their feelings. And so that social connectedness is really important for youth to thrive. So we want these numbers to increase over time. And they have, gone up and down. So very similar trends to what we saw in 2021. And then lastly, just 20.8% of our youth said they get the help that they need when they need it. And so we obviously want that number to be higher. I will close in saying that we are proud to have a joint youth advisory board between the Department of Health and the Division of Mental Health and Addiction. I knew youth engagement is so important here to the commission. Good to see all of our youth here involved today. We we opened our applications for another group of youth to serve as board members to the Department of Health and received over 540 applications for 45 spots. And so youth are ready to be in this space, to advocate for themselves, to see how these results can start changing for them. And so they are here, they're ready. They know what's going on in their lives. So we're so happy to share this with you today and happy to answer any questions that you may have. Thank you.
Thank you very much. Do you have any questions from commission members?
I do.
Well, but
Go ahead.
point of personal privilege.
Yeah.
Senator Jackson, just wanted to recognize you and welcome to, I think your first commission meeting. And I'll turn to you for a question.
Thank you, Mr. Chairman. I apologize for being late. I
Oh,
gave
no, it's
myself
great to
a-
have you. Yeah,
An hour to get here and that traffic still was
I'm sure the
late.
weather helped too, so.
Thank you. And
yeah.
for my question, thank you for your presentation, all the youth who are engaged. I want to throw out though, and this is an oxymoron question. I went to a recent mental health conference by Lieutenant Governor Crouch. It was my second one. And this year she focused on mental health, specifically around our youth. And Dr. Adams was there. And one of the things he threw out, I'm gonna use here too, are we using, because I see the low number, and then we want to get to solutions. Are we doing, and I'm answering the question around the 20% of low numbers, what are we doing, and youth are here and they can answer too. What are we doing and what can we do to change and increase those numbers? I'm gonna throw this out for mental health parity, as well as the solutions. For example, we got counseling, we have access to mental health. But think about this, as a state and as legislators, if we put more money into sports activities, recreation for youth, things to keep positive, legislation around the social media, those things that permeate the causes of mental health issues for our youth, would that help start to mediate some of the issues that they are having? Thank you.
Thank you. I'm so glad Jay sat down right next to you. I will say a couple of the things that I think are important to note, right? This is the data. This helps us drive where do we need to be going to put solutions? We've talked about, and I think it was just honestly the last time that we met as a group, about the connection between mental health and lack of sleep and cell phone, social media usage. And I think having this data to show that only 22% of our students say they get 8 hours of sleep. And we know that that can drive, problems with mental health, and that 76% of them are spending 3 or more hours on their cell phones. That does help us, know, okay, where are some opportunities where we can help engage? So Jay, the question is, what are we doing in the space of mental youth? What are the opportunities? How do we improve these numbers? We did share, and I think that you've seen these slides before, that for sad and hopeless, for considered suicide, made a plan, and attempted suicide, across the board, those percentages have gone up with the 2023 results.
Yeah, and I apologize for being late. It took me 90 minutes to get here from Noblesville, so I did not anticipate that. I'm just filibustering while I think about and answer your question. So, I think there's two dimensions of this, right? There's the demand for treatment, right? And then there's the capacity of the treatment system. Those are two sort of different dimensions. And we obviously have to attack both, right? So we're, the DMHA, we're focused on the capacity of the treatment system to address these issues, but we also know that if the demand keeps going like this, we're never going to be able to keep up with it. And so I think the question that tail end I heard from Senator Jackson and also what you're talking about is we have to start thinking about those the drivers of that demand. And I've often thought sleep, for example, is sort of a silver bullet, right? It's probably the only one, right? So what would it look like, for example, to have, I don't know, a commission on adequate sleep or something? I feel like that would be something, and all the different drivers, I was thinking about the playoffs in basketball. I was up till 11:30 every night watching basketball. It's really? And so I was much worse off. And so that's not getting aside, but I think that those drivers, the demand, we have to start talking about those as well. And so I think I'm glad for you for bringing that up, and I look forward to continuing the conversations.
Thanks. And I will say too, from the Department of Health standpoint, very focused on the prevention piece of this. And I will say, as part of Health First Indiana, some of our local health departments who have school liaisons, some of their schools have reached out and saying, how do we help improve connectedness in our schools? How do we educate around, that the importance of sleep, educate around the importance of not being on your cell phone for 7 hours a day, et cetera. And so we are seeing that happening at the local level.
Representative Vaughn.
So thank you for the data. I guess there was so many topics, and I'd love to have a deeper dive on solutions within each topic, right? So I don't think we can do it justice today, but I'd be curious to see, recommendations or thoughts as they got into the data, and suggestions and that type of thing. I'm always for starting school late or session an hour late, if that helped. But, just saying. But, I
Yeah.
don't know where we go with this, you know, because it seems like it's great data and we
Mhm.
kind of skim through a lot of things really quick.
Well,
And then we don't do a deeper dive.
I was gonna ask a question around, obviously, we don't have the individual schools that are part of this
That's right.
survey,
Yep.
and that's
On
a pro-
purpose.
That's on purpose.
Mhm.
But do you look at, so you pull 50 schools and you get this average data, do you see anything as it relates to outliers that are maybe positive? As it relates to, do you look deeper into their policies around things? Like, let's say their cell phone use is just a lot lower than the trend. Back to your point of kind of identifying maybe inside of the schools that are doing well, maybe there's some best practices happening on campus that you're able to take the data and
I mean, so yeah, so this survey is done across the state. We just get the data, right? But I will tell you again, to draw this back to what Health First Indiana is doing, it is giving us that insight into what's happening at a local level. So we are hearing from schools who have implemented programming. And I will say the ones that stand out to me are the ones that are really focused on connectiveness, employability. So really getting students to meet with each other, you know, meet with their, not just their peers, but also adults, talk about resiliency, talk about sleep, all these things that we're talking about here have seen positive outcomes. We're happy to come back and like do a dive, and we'd have to also bring in our friends from DMHA from the mental health standpoint about what are we doing. But I think the important thing is that we can't just be throwing spaghetti at the wall, and this data helps us narrow in. The other thing this data showed me is we can't take our eye off the ball, right? We saw increasing in students using cigarettes again. We saw an increase in people, you know, driving with people under the influence again. So we have to not say, okay, we fixed that problem and walk away. That the work, the education, the communication that is happening there has worked. That's why we've seen those numbers go on. So there, I mean, there's some silver linings in here. We did see some downtrends in several areas. And I do believe it is because of the work and the education of many of the people around this room.
I mean, the seatbelt one really like
Yeah.
surprised me. I thought everybody just buckled. I just assumed everybody buckled up. I didn't realize it was that far apart.
I think that's a good example. Like, have we moved away from messaging enough about that? And so you know, that will go to my trauma and injury prevention to be able to take that on and say, you know, let's pull out the playbook, what worked before to get people to use their seatbelts, and let's do it again.
Sam Summers and then Senator Jackson.
I think the one that worked before was when your little kids were coming in and telling you, Daddy, stop smoking.
Mm.
You know, and they started with that in the second and third grade, teaching them about how bad that was, and they would go home and talk to their parents, and then their parents be shamed. Or they'd either go sneak outside and smoke, or they
Yeah.
quit. But I thought that was you know, it was, the kids jumped on the adults
Mhm.
for their bad habits, and it worked once.
We know our local health departments that are like engaging with schools, have reported that schools say that they're seeing 5th and 6th graders vaping. And when they do the education, they see it to be very powerful, right? When like an adult comes in. But once you get to 7th and 8th grade and then high school, and we saw those trends in high school where by the time they're a senior, they're really doing a lot of these, you know, unhealthy behaviors. They need to be, then the adults coming in and talking about it isn't helping. It's that peer-to-peer interaction, right? It's the voices, it's the youth groups saying, you know, like, don't smoke, don't drink, wear your seatbelt. And so I think that's where, you know, like our youth advisory board, we need to engage our youth to be a part of the solution here. And those, especially in those older ages. Yeah.
Thank you. I was gonna say, there's some great ATOD, alcohol, tobacco, and other drugs, evidence-based programming out
there are.
there. Are there any implemented in any of the schools that you surveyed?
So that would be under the school profiles, and do we have that reported in here somewhere, right? I don't remember the exact statistic, but yeah, there is a percentage of schools. I think there, in some cases that's gone down. And our friends from the Department of Education are here. I didn't know if you wanted to add anything to this part of the conversation.
Just the aspect that it's gone down.
The program
Yeah, the
implementation
program
itself?
Yeah. Yeah.
And then that we wouldn't probably want to force on from a state level, but is that something that if we fund it, we can encourage. I think I've used and seen those programs and they do work. Even if we modified and get program partners statewide, that could help with the messaging education for our youth and even our younger youth that are using, I think, because it is evidence-based and it does work. That's just a recommendation. Thank you.
Good
Can I
recommendation.
just chime in on
Yeah,
that?
go ahead, please.
So we do have several partners around the state that do implement programming that is evidence-based, that reduces risky behaviors in youth. Our next presenter is one of these organizations that we fund and does this work all over the state. So feel free to chime in and ask her questions as well.
Okay, and I think that's next. Yep, Director Miller.
Yeah, so that was a lot of data and it's really good, but what are the like one or two most concerning data points, trends that you saw?
The health commissioners and-
I will say I was not surprised by any of them.
Mm.
I think one that the reported things around mental health have gone up is something that we should be paying attention to. I think specifically, one, not taking our eye off the ball on some of the things that have gotten so much better, like cigarette smoking and alcohol use, et cetera. And, I'm trying to think. Yeah. So I mean, unfortunately, where we expected things to get better, they did, and where we thought that we may see worse, got worse. But we are excited that we're able to see a trend for the first time, right? We've never had back-to-back before that we can actually monitor this. And I think diving into the data and recognizing, okay, is it ninth graders or 12th graders? Is it male? Is it female? That also helps us drive our implementation.
And just a reminder, for all of us, when will we take the next survey and when will we know if we have statistically viable data to compare with 23? Is that?
Yeah, we'll take the next survey in January through April of
Great. Okay, yeah.
2025. And then we usually
Got
get the
it.
data about a
Yep.
year after, so 2026,
Okay.
2 years from now.
Great. Well, we'll segue right. Thank you very much.
Thank you.
Yeah, appreciate it. Any other, we didn't have any other questions? Okay, great. And next up, I think we've got Tammy Carter from Life Smart Youth on healthy teen relationships. So perfect segue. Welcome.
A little taller. Good morning.
Yeah.
Good morning.
Morning.
My name is Tammy Carter and I am the CEO of Life Smart Youth. I serve on the Child Health and Safety Task Force along with Kate, and specifically chairing the work around the adaptation of effective models for promoting healthy relationships, preventing unplanned pregnancies, and reducing sexual victimization among adolescents. My glasses. Move this ahead. There we go. So I guess my presentation is gonna kind of show what all of this data you just received looks like in practice for organizations like mine. So a 81-year-old not-for-profit that has been doing school-based prevention and puberty and bullying education in Indiana schools. Our mission is to empower youth to make responsible choices and adopt healthy behaviors. And we have about 5 programs that I'll talk about that support that. As I mentioned, all school-based except for when we're in the summer. And this summer, we're in 7 summer programs. All of our programs meet the national and Indiana academic standards for wellness. Some meet the standards around English and language arts and also physical education. Our programs are evidence-based or evidence-informed, and they support a school's desire to provide relevant, age-appropriate, and medically accurate information for their schools. And as you just saw in some of that data, this is not something that all schools are doing. And in fact, in a lot of places, it's declining. Basically, our programs, we start the conversation. We know that we do this in conjunction with teachers. We do this in conjunction with families. We do not conduct any of our programs without a teacher being in the room, and parents, in accordance with Indiana law, must consent or decline for their kids to participate. We are in 9 counties. This past school year, we served almost 15,000 kids. And in 110 schools throughout the state. And this has declined since COVID, as most things have, unfortunately. Kate just shared a lot of the statistics, but we use the data from the YRBS and other data points to refine and decide upon our curriculum. And when something is not working, we do have the courage to change it and adapt as needed in the state of Indiana. As I said, we support families. Parents have a lot of concerns about what's going on with their kids, but in full transparency, a lot of parents don't know where to start with this conversation. They're very nervous about, do I say too much? Do I say too little? What do I talk about and how do I go about this? And a lot of them say we're really excited about having a program like yours around that helps us to have these conversations or at least continuing them at home. Our 5 programs are starts in the 4th, 5th, and 6th grade with puberty. And so puberty education, and then we move into middle school with the 3 R's, and that stands for rights, respect, and responsibilities. And that's a program for pregnancy prevention and STI prevention. Our another middle school program is CARE, stands for communicating and respecting each other. I always mess that one up, but it is the healthy relationships and date rape prevention program. And then our bullying prevention is After School Safety Matters, and it covers bullying in all its aspects: cyberbullying, online bullying, digital safety, but also, very importantly, child sex abuse and body safety, which I'll talk about a bit in more detail. And then in the 24-25 school year, thanks to the support of the Lilly Endowment, LifeSmart Youth will launch a mental health literacy curriculum for high school students. And this curriculum will really give students a language around mental health to start helping them understand what they're feeling besides just using the words of, oh, I'm anxious or I'm depressed, but also help them to identify what they might be seeing in themselves and also in their peers, and give them a safe place to talk about it and some referral information as well. Some of the initiatives that LifeSmart Youth is working with in conjunction with our work for the commission, for sure. And I think you all have a handout that looks like this on Senate Enrolled Act 355. So we're working with the Indiana Coalition Against Child Sex Abuse to really champion funding for Senate Enrolled Act 355. And this bill actually passed and became law in 2017. And it requires Indiana schools to perform or provide body safety for all students from kindergarten through 12th grade. It's a requirement. It's supposed to happen by December the 15th of every year. Doesn't happen. Another unfunded mandate. And so what we're doing with the coalition is we are working with the Center for Violence Prevention to do a research study that shows the effect of child abuse education in the state. So this study will be a significant contribution to literature, and what we're hoping that the findings will help to support the need for resources to show the connection between school-based education, what's being reported outside of school, to give us a more grounding for what support might look like for this. And part of the reason that it doesn't happen is because there's no funding for it. We are also working with IU to provide us a study that will determine the cost, so that the state of Indiana understands that there is a return on investment for this. So we hope that you guys will take this and learn more about it. We're expecting to do a lot of work on it in this upcoming session. In addition, LifeSmart Youth we're working with the Indiana Coalition Against Domestic Violence, and we produced last year a report called Centering Equity for Black and African-American women and girls. And we all know that when things happen, they always happen worse to African-American women and girls. And what we learned out of a lot of focus group discussions, especially, and my component was definitely focused on teens and tweens, was that Black girls, African-American girls don't feel like they have access to education, to medical, they don't trust doctors, and they don't know where to find information. And so we're working, that work is also feeding the commission's work. In addition, As I talked about youth mental health literacy, great opportunity for all of us. And I'm so excited that Mark is adding that to the commission because the intersection of this work, you can't do one without the other. And then I think the other part is we have to think about how we serve disconnected youth. Youth that are not, for us, we're thinking about it all the time, kids who are not in school, who may be in juvenile justice. As we know, attendance is a huge problem in the state of Indiana. So those kids who are not attending school, they still need this information. So how are we going to reach them and serve them throughout the state? So, and then the last part that I'll add is any model has to include parents. And that's true for LifeSmart Youth, and it'll be true for any recommendation that we bring out of our committee. How do we engage parents? We do it in a number of ways. We make sure that parents have access to every bit of curriculum that we're going to teach their kids prior to us teaching it. They can sit down with us. We hold parent night meetings in both English and Spanish. We do them in person. We do them virtually. We have a standing segment on Fox 59 called Kids First on Fox 59, where we provide trusted tips for parents every month. We do focus groups with parents. And so any way that we can engage parents in this work so that we take the fear and stigma out of, we're not grooming kids in Indiana, programs like mine, we are preparing kids to live safe and healthy lives. Any questions?
Thank you for all your work with the commission, but particularly here, and please stay in touch with the commission, and we hope we see more counties continue to benefit from all this good work. So
Absolutely.
thank you very much.
Thank you.
Appreciate it.
Sorry I had to fly through it, but I was looking at the clock.
Oh, we would have caught up. Thank you very much. Yeah, next we've got our presentation on the Kids Count data by the Indiana Youth Institute. Welcome.
Thank you. Good morning. I'm going to kind of wrap up what's been a fantastic morning of data presentations. I am Ashley Haynes. I'm the Vice President of Data and Communications at Indiana Youth Institute. I have one of my colleagues here behind me, Bri Yoon. She's our Data and Research Manager, and I'm delighted to be here with you all this morning. As I'm sure many of you know, at IYI, our mission is to improve the lives of all children by strengthening and connecting the people, communities, and organizations like the Commission who are doing the important work to improve outcomes for kids in our state. The data that I'm going to share today is the data from our 2024 Kids Count Data Book. We aggregate and collect data from state agencies, public data sources, and compile it together. This is the 30th edition of our book. We've been doing this work for 30 years. Some of the data that I'm going to share today also relates to several of the strategic goals and objectives that you all have identified in your strategic plans and some of your specific areas of focus. I want to start off by saying that there is much to be encouraged by in the data. I know that we just heard from the team from the Department of Health that there is a lot of concerning data around our kids' health and particularly their mental health. But compared to the United States, the state of Indiana has a lower percentage of children living in poverty and a lower percentage of children whose parents lack secure employment. Food insecurity is also down, and the number of children without health insurance in the state is at just 6%. These are all great data points. We've seen lower juvenile recidivism rates, fewer children in needs of services, and fewer children living in the foster care system. We've also seen a decline in behaviors that we've long discouraged and that research has told us can have harmful effects for our kids, such as the teen birth rate being down. And even more encouraging, the class of 2023, the graduation rate was 88.9%, and that is the highest rate that we've seen since 2016, and the third highest since IYI has been tracking and collecting that data. And these are all reasons to be encouraged and to be hopeful. They're proof that we can take data and we can move the needle to improve outcomes for our kids and to help us understand where we're making progress and where there is more work to be done. In our data book this year, we have 60 key indicators that we track at a county level that are related to 4 domains that look at the well-being of kids in Indiana. One of those is indicators related to involvement of youth in the justice system, which is specifically related to the Commission's 4th strategic goal. And while the juvenile justice system was designed to operate with the understanding that youth are different than adults, research continues to point to poor outcomes for those juveniles who even briefly come in contact with the justice system. Status case filings like underage drinking and curfew violations have declined by 5% from 2021 to 2022, but still represented 16% of all Indiana juvenile case filings in 2022. And despite this decline in status case filings, delinquency case filings did increase by 17% during the same time span and represented nearly 20% of all juvenile case filings. Like many states around the country, Indiana has made recent legislative changes that aim at addressing the juvenile justice issues. Many of these changes show promise in reducing juvenile involvement in the justice system, as well as improving outcomes for youth that may already be involved. And while many of these case filings can be addressed through community involvement, diversion programs, and probation, there are many filings that do result with juveniles facing incarceration. In 2022, the number of juvenile new admissions increased by 30% to 489, disrupting a steady decline in new admissions that's been occurring since 2016. Over a third of all new admissions in Indiana were for misdemeanor offenses, and less than half, 47.4%, were for person or weapon offenses. This shows that the majority of juvenile new admissions in 2022 were for non-violent and less serious offenses that may have been addressed through detention alternatives. Another group of indicators that we track are related to the foster care system. We know that the foster care system, when operating at its best, is protecting the safety of children and has many positive benefits for our kids. We also know that outcomes of the foster care involvement are not always positive for kids, and that's why we're all here today continuing to do this work. The data from 2023 from the Department of Child Services shows that the rate of children in foster care at some point has dropped by nearly 50% since 2018. In late May, Indiana DCS was nationally recognized for its work to strengthen family supports and reduce foster care placements. And the Indiana Family Preservation Services Program was identified as an evidence-based promising practice. This Indiana program builds its success on the foundation of the Family First Prevention Services Act and has played an important role in contributing to the decline we see in foster youth, as well as removals in CHINS designations. And while many foster care families play an important role in providing children with safe and nurturing environments, in many circumstances, grandparents temporarily care for and raise their grandchildren. Due to the sudden and immediate need of some grandparent caregiver cases, many grandparent caregivers lack the support and resources that are available to those who are working within the foster care system. We have seen that more than 51,000 grandparent caregivers in the state of Indiana were doing so in 2022. Resources and community support are vital components when it comes to assisting grandparent caregivers because 16.5% of these caregivers live below the federal poverty line. Nearly 60% of grandparents responsible for their grandchildren are also currently in the workforce. Research and studies tell us that many may eventually have to leave the workforce to provide care for their grandchildren, while others may have to actually return to work to afford the expenses associated with providing care. And among grandparent caregivers, 44.8% are providing care without a parent present. We just heard a lot of important data from the latest Youth Risk Behavior Survey. It is an incredibly powerful and valuable tool in IYI's work. It shows up in many of our data products, including our data book. I'm not going to focus on a lot of their data because you just heard a wonderful presentation, but I am going to provide some context, particularly in recognition of the Commission's overarching principle of 2 generations. I want to share some additional data about the access of care that's available to parents and children. Indiana has taken steps in recent years to improve mental health care access. And while mental health care provider shortages and access to care continues to impact those who need it but are unable to attend it. In 2022, more than 1 in 4 parents, 27.6%, reported that it was very difficult or not possible to obtain mental health treatment or counseling for their children who needed it. Mental Health America reports that from 2020 to 2023, Indiana placed among the highest quartile of states in the nation at youth who are at risk for experiencing severe depression. And in 2023, 55.6% of youth who had a major depressive episode did not receive any mental health treatment. These data points align with what you heard earlier this morning. They also align with the health professional shortage area designations, which show that 91 of Indiana's 92 counties had a mental health provider shortage, which accounts for nearly 95% of our state's population. Statewide, the ratio of mental health care providers to population was 1 provider for every 500 Hoosiers. We can see how that might impact the kids that just took the youth risk behavior survey that we talked about. If we zoom out a little bit and broaden our scope to primary care and dental health, we see similar trends. According to the latest available data, the ratio of primary care physicians was 1 physician to every 1,500 people in Indiana. And measuring all 3 disciplines, primary care, dental care, and mental health care, 40% of Indiana's populations were determined to be medically underserved. Of course, youth and their families are not the only individuals who struggle with mental health at times or have difficulty obtaining care. The individuals, our youth workers, who pour into the development of our children and nurture their well-being, also face challenges in receiving the care that they need to invest in our kids. And that is one of the reasons why at the Indiana Youth Worker Wellbeing Project, a groundbreaking initiative, is a significant investment centered around improving the lives of Indiana's youth workers. Through a collaborative partnership between Indiana After School Network, IARCA's Institute for Excellence, Indiana Youth Services Association, and Marion County Commission on Youth, and IYI, we're investing in the well-being of youth workers so they can continue to invest in our kids. Throughout this project, qualified youth workers around the state can take advantage of grants, peer support groups, leadership development programs, and access to telemedicine and virtual mental health care, all at no cost to them. Since we launched this partner project on January 1st of this year, the Youth Worker Wellbeing Project has provided telehealth services to nearly 12,000 youth workers across 250 organizations all over the state at no cost. Ensuring that youth workers are healthy and able to avoid burnout is essential to a strong and skilled workforce. We're going to move into talking a little bit about our economic well-being data, and we're going to start with childcare availability and access. These both continue to be focuses for our policy leaders and communities across the state. Because when families have access to quality childcare and early education, children enrolled in these programs have better outcomes across several dimensions in their life and help to achieve many of the strategic goals and objectives that you all are working on in the commission. However, the estimated demand for early childhood programming in Indiana is nearly double the capacity of licensed providers. And of what is currently available, only half of those are high-quality providers. Childcare is expensive and difficult to access for many of our families. The average cost to income ratio for childcare for families in Indiana is 10%, with several counties that are above that state average. Even for those families who can afford childcare, supply does not always meet demand, leaving families with few or no options. The problem of childcare access and cost is often more challenging for those families living in poverty. I know that's not a surprising statement to make. The chart that you see here shows that the percentage of parents receiving childcare for kids aged 0 to 5 from others at least 10 hours per week. And others is defined as daycare center, preschool, Head Start program, nanny, or any non-relative caregiver. We also see that less than half of parents who make less than 100% of the federal poverty level could afford outside sources of childcare. This means that parents who are below or above the poverty level but are struggling to make a living wage may have to make a choice between staying home with their child and not working, or going to work without having reliable childcare. Among households living in poverty in Indiana, 35% are single mother households who continue to see the cost burden of having a child. Nearly 60% of all households living in poverty have at least one child in their household. And based on the available data, we see an inverse relationship between educational attainment and poverty status. Among our kids, 16.1% of children under the age of 18 were living in poverty in 2022. That's almost 250,000 children in Indiana. Of these children, we know that children under the age of 5 have the highest rate of poverty when compared to other age groups. And among children living in poverty, 61% of children live in single mother households. And while there's many challenges associated with poverty, too many to talk about and mention today, a top challenge for families is access to quality, fresh, and nutritious food. In Indiana, 12.9% of children are food insecure, and that means that more than 200,000 children lack access or dependable access to enough food and nutrition for them to live healthy and safe and active lifestyles. We know that children who are facing food insecurity, even for a short time, can face developmental delays because they are unable to get the nutrition that they need. Fortunately, the majority of food insecure children in Indiana are in fact eligible for programs like SNAP, WIC, and the National School Lunch Program. And for many children, school is one of the few places where they do receive consistent and nutritious meals. And for these children and others, missing out on routine and proper nutrition is just one of the many negative impacts that can take place when a kid does not attend school. The chronic absence rate has been an important topic of conversation in the legislature, in the media, and in communities. And as these conversations continue, we know that Indiana is not alone in seeing a sustained and elevated rate of chronic absence among students. The data strongly points to COVID as the likely, or at least the largest contributor to the increase that we're seeing across the state. And even as conditions have steadied and returned to our new normal, we have yet to see a corresponding drop or even return to rates similar to those prior to the pandemic. As the Indiana Department of Education has previously shared, 1 in 5 students were chronically absent from school in 2023, with a statewide rate of 19.3%. And while this rate has improved compared to 2022, it is still nearly double the rates we saw prior to COVID. IYI is an advocate of disaggregated data and breaking those numbers down into the smallest tracked populations. Because when we do, we're better able to understand the gaps and the disparities that exist in the data. As an example, while we see that a statewide chronic absence rate of 19.3%, there were 84 schools in 2023 in which over half of their students were reported to be chronically absent, or they missed at least 18 out of the 180 days in the school year. And if we take a look at this disaggregated chronic absence data, we see disparities that exist between different student populations as well. Among these various populations, we see that Black students displayed the highest level of chronic absence, more than 10% higher than the state average. Across all race and ethnic student populations, only Asian and white students had a rate that fell below the state average. Another gap is for our lower income students. Students who receive free and reduced price meals were nearly twice as likely to be chronically absent than their peers who were not eligible for the National School Lunch Program. When a student is chronically absent, they miss out on important classroom time that can permanently impact their grades, test performance, and even their reading proficiency. We know this in part because there are similar disparities among the same student populations in disaggregated assessment data. We can take iRead as an example here on the screen. Looking beyond the overall proficiency rate for the state, which is displayed as the blue line there across the chart, we see that certain populations highlighted in red fall below the statewide average. Only 2/3 of Black, Hispanic, and early and English language learner students are proficient in reading. Over 1/4 of students that receive free and reduced price meals are unable to read and understand grade level texts. And just as a student's absence can relate to their grades and their academic success, so can a student's reading proficiency. In fact, a student's 3rd grade reading ability is considered to be a predictor of whether the student will graduate from high school or not. This is because students who are unable to read at grade level before the end of their 3rd grade are 4 times less likely to graduate from high school than their reading proficient peers. As I mentioned earlier, a bright spot in this year's education data is the graduating class of 2023 that had the highest graduation rate since 2016. 88.9% of our students graduated from high school in 2023, which is an increase of 2.3% from 2022. And while this is an improvement and it should be highlighted and celebrated that the data is moving in a positive direction, there are gaps if we look at the disaggregated data. Because even as the overall graduation rate increased and did so among most of our student populations, the graduation rate of American Indian, Native Hawaiian, or Pacific Islander students actually declined from the previous year. 1 in 4 of these students did not graduate in 2023, in contrast to the rate of Asian and white children. The graduation rate is a temperature check on how our education system and our schools are doing. It's also a predictor of college enrollment. Research shows that students who didn't graduate on time or drop out altogether are less likely to enroll in college, even if they obtain a GED later in life. A little over half of Indiana's 2021 graduating cohort enrolled in college. And while this is only slightly less than the previous year, it's the 7th consecutive cohort to see a decline. As you see on the chart here, students who earned an honors diploma had the highest college going rate at almost 85%, exceeding the state average. We also continue to see elevated college enrollment among students earning dual credit while they are in high school, nearly doubling the rate of college enrollment among their peers that did not. Among race and ethnic student populations, Asian and white students were the only 2 demographic groups to enroll in college at a higher rate than the state average. And these gaps are not just limited to enrollment, but can correspond to the disparities that I mentioned in proficiency and graduation. Across all of the domains that IYI tracks in our data, we are proud to support the work of the Commission in accomplishing our shared mission of improving the lives of children in the state of Indiana. I'm going to conclude my part of the presentation here. If there are questions, I'd love to take questions. If there's anything that we can't answer, we will take it back and we'll get an answer back to you.
Representative Summers.
Thank you so much for that detailed report. But I kind of want to go back. I got a heart for grandparents. And I think we have brought up that subject and it kind of seems to slip away every 2 years or so. The rate of grandparents taking care of their children is their grandchildren is rising. And have we done anything more around the rights of grandparents to take care of their grandchildren without having to jump through 99,455 hoops? And I just kind of think that it's still a phenomenon in Indiana where there's the number, and I would like in the future to know about that number of grandchildren now that are taking care of their grandchildren, and if they are getting the help. You know, I had this once, but I had a cousin that she was trying to get she got her grandchild eventually, but as a grandparent, the 99,255 hoops that she had to go through didn't make sense. And I don't know if we have made that an easier situation for grandparents, and I would, at this point, like to pin that in for something that we look at, because it was a little covered over, not really any conversation about it. And we know that they are probably the biggest group of people now taking care of their grandchildren. And that's just something that I've got to make sure that we keep in the front. Because, I mean, I'm a grandparent and she's at my house every other week, and when she leaves, I'm like, oh, love her dearly, love her energy, but whew. So as a grandparent, I understand. And, if there was a chance that I had to take her 24/7, no doubt that I would not have a problem with it and would have to come up with some other vitamins that I'd have to take or something to keep up with her. But I think that I just want to bring a light back on to the grandparents, because just wasn't enough said. And that's just, I would like, as a commission member, to ask whether or not we could in the future bring something up about grandparents.
I think we'll just make sure that we visit on that and when we're formulating the agenda for the next meeting.
Okay,
And
I
we can
appreciate it.
circulate it, the executive committee and then to the rest of the commission on what
I
that,
mean, there may be some.
what questions
legislation
we're
that we
trying to
need
sort of
do
answer.
Before,
Yeah.
in the next session that would help grandparents, and I would like to know.
Report on what we've done in that space. And
Yep.
the council.
I appreciate it.
And if there's any data that we can help provide to that, I'm very happy to help do
Great
that.
point. Thank you. Any other questions? Oh, yep, Representative Devon.
Thank you for the data. And I know it's Indiana information, but do you have information on how we compare to other states or no?
So IYI is the Indiana affiliate of the National Annie Casey Foundation. And they actually just released their 2024 book. And in overall child well-being, Indiana ranks 27th in comparison to all other states, which we're not at the front, we're not at the back, we're kind of in the middle of the rankings, and we have been for the past couple of years. Annie Casey, similar to how we structure our data book, they do rankings for each of the 4 domains. For family and community, Indiana is ranked 31st. Economic well-being, I believe, is our highest ranking around, I didn't have it written down, around like 13th. Education, we're ranked around 15th, 17th. And then health, we're ranked around 32nd. And that is in comparison to all other states. So in some of these, like family and community, for example, in Annie Casey's 2024 ranking, all 4 indicators, Indiana actually improved, but we may not have improved at a quick enough rate in comparison to some of the other states. But nationally, we're ranked about in the middle.
Any other, Senator? Yeah.
Thank you, Mr. Commissioner, Mr. Chairman. I'd like to see more information, that information you gave us about disparities around the 250,000 children living in poverty, 61% single mothers household.
Mhm.
Could you give this to us in a slide? And the
Absolutely.
reason I'm asking, if this commission decides to do anything more around childcare, I'm hoping we do. We did something you all did something in 2024 legislative session, because childcare affects education, employment, economic development. And the more we can do around childcare, it will help our economy and our local government here, our body here, not just here, but the whole state, around all those things I discussed. Thank you.
That's a great point. And I think that just to put a finer point on it, we could probably build some presentations around what we've done, and it's a lot, and that's more to do in the childcare access space and what the progress is. We've got a number of agencies here that would have a hand in talking about that. So we'll put that on the agenda as well to discuss on
Thank
how
you.
we could build that into the next meeting.
Thank you, Mr.
Yeah, thanks. Great point. Anyone else? Any other questions?
Mr. Chairman, can I ask a quick question?
Yeah, Bernice. Yeah, go ahead.
Thank you. So 3 data points stuck out to me. The data point about 3rd grade reading proficiency, graduation rate, and then the percentage of students who pursue college. When I looked at that data, and now I'm just going from memory, with respect to Black youth, the 3rd grade reading attainment was low. The graduation rate seemed rather high. Well, I'll say it surprised me how high the graduation rate was for Black children in connection to the low 3rd grade reading attainment. And then the college, going on to college also seemed low. So it just made me worry, those 3 data points, whether Black children are sort of just being passed on or just graduated when they haven't really substantively attained a proper, high school education. That probably isn't something that you can answer, but those 3 data points just didn't seem to make sense to me. But if you have a thought on that data, I'd appreciate it.
Yeah, so I definitely can't answer the reason why the difference may be, but I will say with the 3rd grade reading data that we share that's included in this year's data book, we are starting, like some of those kids were in kindergarten in 2020. So we are starting to see in some of our young learners, particularly in that important iRead and those early iLearn tests, kids that were impacted by by changes to their education due to the pandemic, whether that was missing school or the changes in virtual education during that time period. And we'll continue to see how COVID has impacted particularly education over the next couple years as data comes in from the Department of Education and from our other state agency partners.
Any other questions? Ashley, thank you.
Oh, thank you.
Thank you. Mark, it's all your show.
Oh, don't say that. I've got extra time. All right. All right, well, here to close things out, and thank our guests for coming and doing the data presentation. I know it's a lot of heavy stuff. Especially we got that nice gloomy day outside, but it does remind me always why our name is improving the status of children. We're not at a perfection point. We are not going to pretend we are. We've always got to move towards better, whatever we're doing. So I have the pleasant part of the day where I get to talk about some things that we are doing, so we can talk about some of our forward momentum in these spaces. So a few quick things on the update list. A few months back, we created an early childhood mental health subcommittee talking about that 3 and younger group and the limited resources available to them throughout the group. So we do have, that has now been formally co-chaired. So Steve Awig, who presented on it, has been joined by Courtney Hott, who's with the Indiana Early Learning Advisory Committee. So we're looking at that kind of from both ends, because we know there's a provider space there with those early learning spaces to improve mental health availability as well. They've identified some very early goals, but they're mainly looking at bringing in other folks that have expertise in that space because it's a very limited space and we know we need to have more expertise built there. And they're also looking at how our new community mental health model, as that slowly gets to unfurling, how we can make sure we're building in that capacity for that very early age in there as well. And of course, looking out for the parents that are working through some early childhood issues with their children. Next up, our most recent meetings, we were talking about our new task force, looking at bullying, suicide prevention, digital well-being, and online safety. I'm happy to say that we have gotten co-chairs in place for that. I know we've talked about how that was kind of interwoven across many of our task forces and committees in the past, but we really wanted to pull that out and emphasize. So our co-chairs on that will be Michelle Bullington, who is our state suicide prevention director. And we're also having from the Department of Education, from Project Aware, Sarah Allison will be co-chairing that. So we have 2 of the really key agencies that work in that space. Again, we know it goes across so many, but starting that process.
What was Sarah's name?
Sarah Allison. Mhm. Now, under that, we will be doing things a little bit differently because usually task forces were created as an element spun off of our strategic plan. So we did meet with the executive committee and discuss how we want to do that this time, because we were looking at this as an urgent enough need. We don't wait until 2025 and start building into the next plan. We want to make sure that we have that pull out now. So it's agreed, really, the topics that we assign to it will be the subcommittees. There will be a bullying subcommittee, a suicide prevention subcommittee, online safety subcommittee, and digital well-being subcommittee. What we're going to be doing there that's going to be unique versus our others is each of those subcommittees, our goal is to have them chaired by a youth or family member. We have, of course, been trying to integrate more youth and family voices throughout the commission, but this cluster of topics really needs to make sure we have them leading the discussion as that starts going forward and we start filling in some of those recommendations there. So we're going to take the time to do that properly and build it right, and maybe have a model for some of our other task force moves in the future. But happy to be moving forward in that way. The goals for each one of those subcommittees are going to be very broad because, again, it's usually fed through the strategic plan. So we're going to be looking at giving them broader permission there, essentially researching the issues, reporting back to the commission, and then making recommendations as appropriate through that discovery process. So they'll all kind of be operating under those same goal areas as we move forward. So looking for all the membership that we can get for those issues. So as you know, as specialists, and we had a couple that, we're speaking today that already made my list. So don't worry, I'll be bugging you.
to really fill that out and focus in on those issues because we want to make sure they get the dedicated attention they deserve. So very exciting to see that moving forward and hopefully have things going into the next legislative session, at least some early thoughts and recommendations that we can be talking about. Again, long-term commitment that we're making in that space. Speaking, yeah.
Should anybody reach out to you if they're interested in being part of that task force?
Absolutely. Anybody that's interested in being part of the task force or one of those specific subcommittees, they can reach out to me directly. And we'd be happy to have them make that linkage. So, and again, emphasizing community, parent, and youth voices on that is really key. So especially if you know some of those individuals that want to be a part of that, definitely send them my way. All right. Next up, continuing on some good news items. I am happy to announce that Indiana was selected for a national initiative called the Best Youth Initiative. It stands for Building Ecosystems Statewide for Thriving Youth. And yes, I realize they probably started with best and then had to fit the words in that went with it. We've all been there. We know how acronyms work. That's okay. This is from a group called the Forum for Youth Investment that we've worked with on and off several times over the years. But what they were putting together is a project base where they were going to select 5 states from across the country that would create teams of both agency leadership and youth and families that would work on specific issues that cross across all of the systems in their state and come up with solutions for those. So we were given the option of going for this really close to the deadline, but we had several of our agencies step up. So our Division of Mental Health and Addiction is going to be part of that, Department of Health, Department of Education actually signed on as the lead agent with that, and of course, the Children's Commission as well. More importantly, we have youth attached to that and a parent member attached to that as well. And I would point out they were the quickest and easiest and most excited to sign up. They really, I can't emphasize enough the earlier points about how our youth are ready. They're ready. They really are. So we have some of our existing friends. So Ellie Leonard's going to be working on that with a little bit. We have from the Youth Advisory Board that was referenced earlier, Faith Brothers, Lucia Mercado, who is presenting last meeting, stepped up for that, Kylie Roop, and one of our task force members, Kaylee Price, are all going to be part of that. Our only youth representative that's not a part of it at this point is Julia Stumler, because she's showing off in DC for a summer placement. So we've got a lot of our folks doing some wonderful stuff, and we're happy to see that. They were given the option of what issue they want to work on when we applied for that. And both our youth and professionals agreed on the issue of chronic absenteeism. So again, noted in both of our presentation sets today how huge that is and how much it needs to be informed by youth and family voices. We've got a lot of them being ready to be heard in that space, wanting to be heard in that space, and with a lot to say in that space, and talking about the issues that surround that: health, mental health, safety. You know, if my community's not safe, does my school feel safe? What's keeping me from being at school? So they're wanting to be a part of that discussion, and they're aware of a lot more than we give them credit for sometimes too. I know Judge Kenworthy and I were talking to a group a couple of weeks ago that was talking about chronic absenteeism and mental health were two of their big topics. What struck me, and I know it struck her too, is their awareness of their own mental health and needs is higher than I definitely remember being when I was growing up in school, and their ability to articulate that. It was really one that resounded with me as they said, you know what, somebody needs to check on getting better services for our teachers because they need help and they need looked out for, and their mental health is suffering. Now that's a kid that has some good mental health literacy, and that's a kid we need to listen to. Right. So this initiative will go on over 3 years. We'll have some trips out to DC with our youth and parent representatives and our agency folks. And then also work here where the forum's coming in and providing some technical assistance with us as well. But we're very happy to be chosen as one of those 5 states to really put our mark out there that we're taking these voices and putting them first in our discussions and integrating them in whatever we do. So very, very exciting there. Then my last item on the agenda today, Casey Family Programs, who has given us some grant funding for several years now. We have the pocket of funding that we're using for this fall's programming dedicated to doing some specific trainings that we're going to have youth-led and youth-facing on strategic sharing, which is the concept of for our youth who are engaged and looking for a way to become engaged or want to use their voice better in these spaces, teaching them how to do that and how to do that effectively. So telling their story, using that, leveraging that, how to be present in spaces, how to not be scared of the State House because they don't know you guys like I do. You're not that scary. Well, Representative Summers a little bit sometimes, but
I'm sitting here minding my own business. You remember that, minding my own business?
let the minutes
After I
reflect
get
that
out of here.
Representative Summers was highly defensive about that accusation. So.
Dale, you didn't even defend it. What is up with that? Okay, well, I
Yeah,
got something for you.
the defense is not on the agenda, so we'll move forward. So that will all feed into our February activities for next year. As we noted this year in February, we had our President's Day gathering at the State House where we had youth coming out and being part of IY's State of the Child address and our Day of the Child activities. And we had around 500 youth show up for that. So we'll be elevating that this next year to be doing both that event and the day after some intensive work for our youth that want to take it to the next level and get to using their voices meaningfully. So that's being planned by our commission staff. So Blaine and Peyton are working on that along with our youth representatives. We'll also be bringing in a second formerly known as intern, now known as Jean Bro Fellow, to be working directly on that project as well. So we're giving it all the resources we can. And yes, as you can see, we've got a lot of youth and family stuff going on. And you bet this is me making the light pitch that eventually we're going to need more resources for the commission to keep doing this work and elevating this work. We're working on our capacity as well as we can to get everybody involved that we possibly can. And this is really exploding, but in such a wonderful way. We love what we're being attached to. We love where it's going. Now we got to make sure these youth voices, these family voices, we do them justice and we're giving them proper support as we move ahead. That's me for today.
Mark, thank you and congratulations on the Best Youth Initiative. 3 years, is a long time, so that's great. And just want to thank all the presenters that came and presented all the data, and it is a heavy lift. And also just to thank everybody for their participation. I think it's pretty rare that you get this type of group together on a regular basis and have such active engagement, much less sort of attendance for 2 hours in the middle of a work week. So thank you all for your continued participation. Along those lines, we've got 3 more meetings coming up. Next one's August 21st. We will take back a couple of these agenda items around the grandparents and familial support, as well as childcare initiatives and circulate next week's or next month's agenda. So,
Chairman,
yes.
if I can make a
Representative,
comment.
You may.
A few of us went to a Casey conference in Chicago a couple weeks ago with Representative Pryor, and Jackson was there as well with David Reed with DCS, had joined us and was one of the presenters. So it was really great and informative. One of the shocking things is in the United States today, we're spending about $220 million a day on abuse and neglect in child care. And that kind of blew me away. But one of the things that I think we need to look at and investigate is that we had a pilot program a few years ago that created these child care centers, not child care, but it's a more of a kind of a one-stop shop for moms looking for help. And I'd like to go statewide with that. I want to try to maybe create a forum to look at how effective those centers are and to see if we can get some data from those to say, look, it's that important that we can really help these kids and these families succeed in life. So the other thing is, I know we talk about quite a bit. I know I'd love to talk to Kenworthy a little bit more about it, but it seems like childcare, a lot of kids don't get representation in courts. And I'd love to do a deeper dive on that because it seems like we're one of just 6 or 7 states that don't have representation for kids, either in foster care or even homeless in the country. But I talked to a lot of judges and other people that are involved, And they're saying we got too many attorneys in the courts already, so we want to add more, but are they effective, right? Are we really getting kids the help that they really need? So it's just
No,
a discussion point.
You
I'd
have
like
great
to-
discussion points and we can,
We actually have slated for our next
Oh.
meeting already. We have slated for the next meeting already some discussion on how the CASA program can have increased access to that legal representation so we can build a conduit there. But also looking at the other items you're talking about, our prevention programs and our family resource centers, they've been asked to present to the next meeting too. So good segue.
Thank you.
and with that, we're adjourned. Thank you.